Hi everyone. Today we're going to talk about the clock drawing test. It is an important test for executive function. It's also an important test. It's probably one of the more difficult questions you can ask patients in a screening atmosphere. So along with the 3-item recall, it makes up the MiniCog, which is going to be your quickest sort of first thing that you can do if you've got someone who's reporting memory loss. What I want you to do here, and you've got the whole page to work with, so go ahead and make it kind of big if you want to. I want you to draw for me here, listen to all the instructions. I want you to draw for me the face of a clock. I want it to have all the numbers on it, and I want the time on the clock to show 10 minutes past 11.
Okay. That's a little bigger. Okay.
And then voila. Very good.
Okay. They're not too even, but...
Excellent. All right. Thank you. So whenever we're scoring the clock test, there's really 3 points that you're going to be looking for. First point is whether or not the patient draws a completely closed shape. Usually a circle, a square, or grandfather type shape is also acceptable as long as it's completely closed. The second point has to do with the numbers. So you're going to look for the correctly positioned 12, 3, 6, and 9. And then you want to see the rest of the numbers, of course 1 through 12, in the correct positions to kind of fill up the 4 quadrants. You can see here that she really hasn't spaced things correctly, and that speaks to some poor planning on her part as far as the visual spatial aspect of the clock. The third point has to do with the correct position of the time. What you're looking for is that there's a centrally located center point. Here she's a little off, but it's not too bad. You also want to definitely see a well-demarcated shorthand pointing to the hour you've asked for, 11, longhand pointing to the minutes, in this case the 2. So the total score for this patient is she gets a point for her closed circle. She gets possibly a point for her numbers. I actually feel she doesn't get points for her numbers, but I did go ahead and give her credit for the time. So she's somewhere between a 2 to 3 over 3. So on this clock, I want to point out a couple things. So let's think through how we score our clocks. First, we're looking for a closed shape. So she clearly gets 1 point for the closed shape. Then how did she do on the numbers? Well, she's got her 12, her 3, her 6 is a little off, and her 9. Let's draw our quadrants and see. She's really a little off, isn't she, on a number of different spaces. She really had some trouble, so I don't think we can give her credit for that. So she's still at 1 point. And then let's look at how she identified the time I asked for was our standard 10 minutes past 11. Her center point is not too far off, but she's made what is a common error, and that is that in this case, the shorthand is pointing towards the minute, and the longhand is pointing towards the hour. So she does not get credit for the correct placement of time either. Therefore, she ends up with a score of 1 out of 3 on this clock. I hope you feel more comfortable with using the clock drawing test. It really is a good differentiator. You'll be probably surprised by how patients complete that task, and it will help you identify people who are starting to have trouble with executive function. I also wanted to point out one thing. If you end up using the MiniCog, which is a terrific, really brief, easy to do in your office screening that involves a 3-item recall and a clock draw test, you'll see if you go to the Alzheimer's Association site that they have you use a clock draw test where the circle's already completed. That's fine. The more important points of the clock completion that we've just gotten done talking about are the the numbers and where the numbers are placed and how they're placed within the quadrants. Now you know to look for the spacing, and then of course the time and how the individual either centers or doesn't center that center point of the two hands, and whether or not they get the hands correctly placed with a short and long hand. So it's okay to use the MiniCog and to use the clock draw test this way. You just want to look for those features that we talked about if you do have people do it freehand as well. So now you're set. You can use the clock draw test anytime you need to.